Okay, in Sweden, larynx cancer has an incidence of about 200 new cases per year. There are between 50 and 85 years old, most likely in men. Laryngeal cancer depends on the location and size of the tumor and the possible present metastasis. Here is important to mention that discovered at early stage, and there are several ways of trying it: radiotherapy, chemotherapy, and surgery. In radiotherapy, there are two options for voice quality. First is affected after rehabilitation, or there is a spontaneous improvement. And furthermore, according to the studies, there is no return to normal function. It's important to mention that other studies analyze the results with a multidimensional approach in which they includes PRO, acoustic, and perceptive. This study aims to further investigate whether the voice improves after rehabilitation.
For the materials and methods with the control, male patients were selected from western part of Sweden and with glottic and supraglottic cancer stage T1, T3, treated with irradiation. In the inclusion criteria, we had that the patient had to good cognitive abilities, speak fluent Swedish, and he be able to complete questionnaires. And in the exclusion criteria, we had the patient that received surgical excision of the tumors. An assessment battery was used which had voice recording where samples were obtained from the patient, reading, spontaneous speech, and maximum phonation time. And in the second part, he was asked questions about the voice and communication of the participants, and then made acoustic analysis with breath. 1 and 6 months after the oncology treatment cessation was performed voice rehabilitation according to the structured protocol. After, statistical analysis was performed with MAC version 20.0, Wilson Pearson rank test for the difference within the groups, and Med Whitney U test between groups analyzed were carried out. And in the finally ethical aspect, it was conducted according to the Declaration of Helsinki, approved with the ethical committee of the Sahlgrenska University Hospital, and all the patients think their informed consent before starting the study.
Well, the results were divided into three parts. First, the patient. Here, no statistically significant difference were found. Two, in voice analysis we have first acoustic and temporal analysis. Two, fundamental frequency for the study group is close to normal values both after and before rehabilitation, while in the control group they deviate from the normal values. 4. Harmonic noise ratio in the study group improved by 1.1 decibels, but with lower distribution after rehabilitation. And maximum phonation time (MPT), the study group improved 1.1 seconds, while control group deteriorate by 1.8 seconds. Okay, in the third part, voice self-assessment, there is the vocal fatigue that improve in the control group, the vocal loudness that improve in the study group, and the journals that had only a small change. Overall, there were no statistically significant change before and after rehabilitation.
Okay, in the discussion, a patient with laryngeal cancer present problems after from radiotherapy. In a study by Agarwal, the voice quality after from radiotherapy present disruption on HNR values did improve in comparison with health patients. Leopard showed age in air values improve 1 year after completion of radiotherapy. Similar improvements have been found in this study. Now, in this study differ from early studies because in the study group vocal improvement is evident and in control group deteriorates over time. This means that the voice rehabilitation after radiotherapy for laryngeal cancer result in a better voice function. This article had as hypothesis that the patient in the study group would obtain a better voice quality due to the better voice technique. A subject that caused curiosity is vocal fatigue because the control group did not present it while the study group present. This may because the study group performed vocal exercise at home and the other group didn't, so it can be said that more vocal use per day, more vocal fatigue there will be. The statistical information had a significant difference. The voice rehabilitation improved, but the lack of a statistically significant difference be explained by the small simple number. In the future studies, the use of pro instruments to better appraise patient communication is recommended.
Okay, in conclusion, despite the lack of statistical differences, great improvement can be observed in the disturbance and the self-evaluation of the study group. To evaluate the efficacy of voice rehabilitation in patients with laryngeal cancer, randomized studies are needed.